There's a big queue outside.
Good morning to everybody. Have we had apologies for absence?
Yes. Councillor Seaman, sorry.
Okay, he's on holiday, I believe. Any declarations of interest?
No.
No? Minutes of the last meeting, got any matters arising? No. Agreed?
Yeah.
Brilliant. Okay, let's move on to human resources update.
Thank you, Chair. So I'll take you through this report. This is the standard quarterly HR metrics report that we present. Just for you to note, this data is taken from quarter 4 of 25-26, so January to March of this year. So we are somewhat delayed because we're not at the end of this quarter yet. So that's why it's only one quarter's worth of data. There's also an additional recommendation that I'll draw your attention to when we go through the report related to the HMI values and culture report. So the first section of the report at section 2.1 talks about establishment management. Really nothing of note to report. Our establishment for whole-time on-call and Green Book colleagues remains very stable. And if you look at the turnover rates at section 2.8, again you'll see that they are remaining low. The majority of the turnover for the whole time cohort attributable to retirement and reasons for leaving for other staff groups fairly evenly split between retirement and resignation. And then you'll see the turnover rates by the last 4 quarters, so nothing really remarkable to draw your attention to in that data. Section 2.10 onwards talks about sickness absence, and that's broken down by each of the staff groups. So for whole-time staff, which is section 2.14 onwards, you'll see the figure 7 shows that whole-time sickness absence rates are broadly in line with the same quarter from the previous year, and are also below the so the national average line is the upper line on your graph. So you'll see our local rates are below the national average. I think we did a deep dive into sickness during the last meeting. So at figure 9 on the next page, that shows the top 3 reasons for absence. Again, no surprises to see that musculoskeletal is the highest. We've got hospital post-operative and mental health reappearing in the top 3 reasons for absence. I think when we spoke about this last time, we talked a lot about the impact that long-term sickness absence has on the data, and again that's reflected this time. So we've broken down the number of occurrences and the number of days lost by short-term and long-term data, and because the cohorts of staff that we're talking about are not very big, so just over 400 whole-time firefighters, long-term sickness absence soon starts to have a disproportionate impact on your average days lost because of the size of the cohort. We've talked as well at section 2.20, we've talked about this before, the amount of hospital and post-operative absence that we're seeing, and that remaining in the top 3 reasons for absence, and some of the challenges that we've got both with an ageing workforce and also with some of the delays and waits for surgery at the moment, we think is having a knock-on effect on some of our absence rates. With regards to the on-call cohort, so this is section 2.22 onwards, you'll see that our sickness rates, which are the top line on that graph, are really disappointingly high for this staff cohort. We've been working hard to try and manage the on-call sickness rates, and the work that we are doing is not having the impact that we would like it to have, if I'm being honest. When you look at the breakdown at figure 11, again you'll see musculoskeletal, mental health and hospital post-operative, so nothing remarkable in terms of the reasons for absence, but having looked at the data, we think that long-term sickness absence is having a significant impact on the average shifts lost for this staff cohort. So the sickness rates that we're seeing at the moment are significantly higher than for the same period last year, and are also higher than the national average fire and rescue service rates, so it continues to be an area of focus for us. In terms of Green Book sickness absence, this is section 228 onwards. Sickness absence levels have increased very slightly from the previous quarter, but they remain below the same quarter last year. So the line that you're looking at for 25-26 is the one that starts at the bottom of the graph, and then it's slightly overtaken in quarter four the National Fire and Rescue Service average, but is still well below the same period last year. So broadly a positive story with that sickness absence. And again, the reasons for absence, which are in figure 13 at section 229, respiratory, which is unsurprising given the time of year that the data is taken from, which is really at the tail end of the winter, and then musculoskeletal and mental health appearing there as well. Section 231 onwards talks about our occupational health and fitness services. I think we've presented this to you before, so I'm not going to go into a lot of detail on that, other than to say positively we redeployed some resources to be able to recruit an additional occupational health nurse into our occupational health team, and they've now started with us. So that's enabling us to do two things. One is obviously to see more people, but two is also to bring some of the occupational health services that we were outsourcing to a third-party provider back in-house, and we think that's really going to help with continuity of care and also quality of provision. Section 237 onwards shows the employee relations data and the casework data. As usual, those numbers are relatively low, so it's quite difficult to break it down beyond what we've provided to you in the table there. But it does link through to the next part of the report, which is at 239 onwards. So I'll just explain briefly, because I think when we started reporting this through, some of the members who are on the committee now maybe weren't on the committee when the HMI Values and Culture report was first published. So it came out a couple of years ago, and what it was a specific thematic inspection which the inspector undertook into 10 fire and rescue services, of which we were not one, but they also reviewed all of the values and culture learning that there had been from all previous inspections, and they produced a thematic report with some specific recommendations for chief fire officers, specifically around the topic of values and culture. So there were 35 recommendations in total, of which 20 were delegated to chief fire officers, and we have been reporting them through to the committee for some time. What we'd noted were that there were 4 recommendations that we had not brought to the committee for assurance and closure, so we've included them as part of this report. So I'll just run through those. So the first one that we're seeking to give you assurance around is relating to disclosure and barring checks, so DBS checks. So the Values and Culture report enacted a legislative change which enabled us to conduct DBS checks at a standard and an enhanced level, depending on the role that colleagues are doing in the organisation, and has also enabled us to check more frequently. So we're now on a 3-year rolling programme of checks for all existing colleagues, and all new starters to the organisation have had DBS checks for a couple of years now when they've joined us. And that's complemented by the Nottinghamshire police vetting checks that we have to do for colleagues who are located at this site, and also we have a process for enhanced security clearance checks for some roles in the organisation where that's warranted as well. So we're now 2/3 of the way. We're 2 years into our 3-year check-in cycle for existing staff, so we're confident that the DBS process is now embedded into the organisation. The next recommendation relates to the fire standards, which are specifically related to leading and developing people and leading the service. Again, we've got strong evidence internally that fire standards as a whole are routinely reported through to SLT in terms of our progress against those in all areas of the organisation. We've specifically reviewed the leading and developing people and leading the service fire standards, and we continue to use those as part of our continual improvement journey. So again, I think we can satisfactorily evidence that the progress that we've made against those. Recommendation 22 related to undertaking 360-degree feedback for all managers. So previously, 360 feedback has been open to middle and senior leaders, but not those at supervisory level. There were some challenges in terms of we used an external provider to deliver it, but because of some of the methodology, putting large cohorts of staff through meant that because we're quite a small organisation, we were getting lots and lots of people asking to feed into the process. So, for example, at one time I probably had 10 people requesting feedback from me as part of their 360 process, so it was quite difficult for us to coordinate. We've now sourced a new provider, and 360 feedback will be open to all managers in the organisation. It will be a voluntary process still, because I think that's the most constructive way to deliver it, and we will be focusing on those people who are either have been through promotion processes or who are seeking promotion and development. And we've also now trained internally our organisational development team, so they're now able to give the feedback to staff, which again, from a continuity of leadership and management development, I think is a really positive thing. And then the final one, recommendation 24, talks about watching team cultures and about how we review and assess culture down to a team level. So there's a couple of pieces of work that we've done to support that. One is the culture dashboard, which is now available with different levels of data available depending on your position in the organisation, and also the regular staff surveys that we run, and also we've just undertaken a wide scale listening and learning exercise which has involved face-to-face conversations with all of our whole time and the majority of our on-call crews as well. So we've done some analysis on that, and recommendations again have come from that, some of which are related to specific locations or specific teams. So hopefully that gives you some information about what that is, and that does relate to the first recommendation in the report about endorsing the closure of those remaining recommendations. So happy to take any questions.
Thank you, very thorough. Have we got any questions, colleagues? Wendy?
Yes, just one. Thank you. Sorry, Richard. Going back to the 220, no, 222, for the on-call rolling staff,
Yeah.
and the figure being high. You're saying that unfortunately the work that you've done on that to try and improve it hasn't sort of paid dividends. What can you do going forward to try and bring that down?
Yeah, so there's a couple of things that we've tried already and we're going to keep going with. So one of them is working through our fitness instructor and the occupational health team to try to support firefighters back in. So, as you know, we really struggle with recruitment of on-call. So we don't want to lose these people. If there's a possibility, we can bring them back. So we are doing lots of work around preemptive health support, so making sure that people aren't lifting too heavy in the gym, but they are doing the right kind of body conditioning to be able to maintain their health right through into older age, really. But we're also working with those individuals who are perhaps waiting for appointments to support them through our health provider to make sure that they can get scans early or things like that where they need it. They'll be able to do that and then claim the money back. We are limited because we can't provide the operations. We still wait for the NHS with some of that, but wherever we can, we're working with them to bring them back in, and also having very realistic conversations about actually, if it's not possible to return, what does retirement or leaving the organisation look like, so that we are being honest about the reality of people returning into the workforce. But wherever we can, we're working really closely with them and their managers to bring them back in as quickly as possible, really. Some of it is the same people that are in the whole time, so that injury prevention is one of our key drivers in that area.
Thank you.
Richard?
Thank you. With mental health, we're seeing an increase in mental health cases, reasons for absence, both in the frontline service, so on the whole-time service, I should say. Is it? Well, actually, we're also seeing it in the Green Book as well. Yeah. So, is there some sort of pattern developing here? I mean, do we know if the increasing mental health cases is work-related, or which you sort of perhaps might understand in whole-time sort of on the ground with difficult situations? But I'm just really wondering whether you find out whether it is primarily work-related, or maybe there's other things going on in people's lives. And then on the Green Book side of things, that seems to have gone up quite a lot, doesn't it, the mental health? Which again, I just wonder if we have is there any pattern or any particular reason for it? Again, is it work related? Because on Green Book, you may not expect it as much on sort of non what's the expression,
Traumatic.
yeah, without the traumatic cases. So how are we sort of checking that out, and do we know if there's any sort of pattern or reason?
Yeah, so we do look at the data. Very few of them are directly attributable to work, in the sense that they have a stress risk assessment, or they've gone through a kind of post-traumatic incident stress type. But it's quite difficult to differentiate. Some people might feel that it's work-related, but they also have things going on at home.
Yeah.
Some people become overwhelmed by a workload rather than by an incident, so that sometimes features in the mental health that we're seeing. What we are trying to do is make sure that the support is there early. So we've just released new trauma awareness training to the whole workforce. That was really well received and has been developed with the workforce and with the unions as well. So that's just gone out as e-learning with some really useful videos about what to do if you're experiencing this, what's within normal expressions of how you might feel for a week, and when actually this has gone on too long and I really need to reach out for help. We're then complementing that with training for managers at every level on their responsibilities of supporting people through a welfare situation, whether it's at home or at work. And we're upgrading our support through a change in our mental health and wellbeing policy that is going out. It's kind of going through consultation at the moment, but we will be looking to implement that. What we want to do is make sure that people ask for help early and that they get the appropriate level of help. So we work with a condition management company through occupational health, who are specialists in providing support for post-traumatic incidents, but also mental health conditions. And on top of that, we do have our 24-hour helpline and our support service, which you can kind of use on your phone as well as an app that you can ask for support on. So we have a lot of different avenues for support for colleagues. It's making sure that they are understanding that they can call those and that they don't need to go through their manager for a lot of them. So for life events, bereavements, divorce, those kind of things that happen in everybody's life but have a big impact, they don't need to go via their boss. They can seek that support directly, so we provide that as well. Yeah.
Okay. And I wonder as well whether there might be something in the fact that nowadays there is less of a sort of stigma in people sort of saying that they have got a problem, an issue. I wonder if there may be something in that perhaps.
Yeah, we've done a lot of work to destigmatise it and to make sure people
Yeah.
recognise it and are able to get the support that they need. So that might be a factor.
I think as well, you know, when you look at the service, we are a microcosm of wider society, aren't we? And you know, the things that you see on the news about the impact that mental health has on people's ability to work, the numbers involved in that, and I noticed in section 213 we'd included, it's a little bit out of date, it was published in September 2025, but the CIPD survey indicating that it's not just us that are seeing increases, it's a national pattern of increases in sickness absence. I think some of it, and it's not to say we just need to throw our hands up in the air and give up and not do anything about it, but I think some of what we're seeing is a consequence of other things that are maybe outside of our control a little bit.
I think just to really a statement more than anything, I think the kind of pinpointing it early and signposting people is really, really important, because I was delivering a session a couple of weeks ago where I was actually saying, you know, there's research that's been done and the probability of dying early, I know that's a bit drastic, you know, for obesity and then excessive drinking and then smoking, but then actually poor social relationships actually out-trump all of those factors that are really obvious factors. So I think if it is something that's happening outside of the workplace, a lot of people as well might be, you know, they kind of have that facade and don't necessarily think that they want to disclose that information in the workplace. But I think that signposting people early on and the fact they don't have to go through their manager is really helpful.
Yeah, it's certainly been feedback from the workforce that they want to have that option to not talk to their manager. They like to be able to come to work and be their whole self at work and not necessarily bring whatever's going on at home with them, but we also want them to access that support. So
Anything else, colleagues? No? So I thought you were going to say something there, Andy. Okay. So it's recommended that we endorse the closure of tracking of HMI FRS values and culture report, with all actions complete and tracked through the workforce plan and internal assurance to ensure sustained improvements, and that we continue to scrutinise performance and seek assurances from the people-related performance metrics. Mouthful. Is that okay?
Yeah, absolutely.
Do you want to read it again?
No. Okay, so we're on the workforce plan, 25 to 28.
So I'll hand you over to Amy for this one. Thank you.
Thank you. So back in June last year, we brought you the workforce plan, which looked at how we were going to implement elements of the people and culture strategy and improve our workforce planning, as well as setting some ambitions around workforce diversity. So the workforce plan gives an overview around current data in establishments, turnover forecasts, looking at recruitment processes, our aspirations to strengthen our workforce planning, attendance data, workforce diversity, and the development and maintenance of operational competencies. You've just heard quite a lot of that update in the previous report, so I'm not going to go over all of those things. So just to pick out the elements which haven't previously been covered, this report largely focuses on our whole-time recruitment campaign from last year and the positive action work that we did to go with that. So in order to achieve our diversity ambitions, we undertake a programme of positive action prior to the recruitment opening. So that's making sure that we are delivering a broad range of activities that people can get involved in and understand who we are and want it to work for us. We found particularly that our Have a Go days were very successful within that. We had a lot of engagement from different communities. We spent time with faith groups, at community events and things like gyms and park runs where we thought we might be able to attract diverse talent. The Have a Go days were attended by over 150 people. 112 of them went on to apply, so we can see there's a really strong alignment with that. They gave us really valuable feedback about how important it was to actually get on the tools, to see diverse faces there, and to understand what it would be like to go through the recruitment process. They were very positive about the delivery of those sessions, and we're grateful to the firefighters who gave up their time to come along and support us with that. The format of those Have a Go days has been refined and improved over the years, so as well as getting a chance at having some of the job-related tests, there's an opportunity to understand more about who we are as an organisation and what the workforce do. Alongside that, we delivered online mentoring sessions, which we perceived as quite a low cost but high value offer. They were well attended and people took the time to understand what it's like to work for us again and what kind of things in terms of support they could receive, as well as what might be some of the challenges. Partly what we're aiming for there is people really understanding before they arrive with us the level of fitness that they need to have before they reach our training centre, because there's a lot to learn at training centre. We don't want people who aren't fit enough starting on day one and finding that that's the challenge that they're dealing with, as well as pumping and learning a lot of science and all the other complicated things we expect them to take on. We did do quite a detailed analysis on our positive action programme and found that some of the tools we were trying to use for data collection, including QR codes, perhaps didn't serve us as well as we would have liked. So we will look to review that next time we do a whole-time campaign. One of the key things we learned from that was that actually we need this continuous all year round activity. So you'll know from previous meetings that we now have our community education and engagement team who are doing always on engagement with different communities. They will be establishing the Fire Cadet programme, which you might have seen advertised. That starts in September, so we're really excited to get some young people in and start helping them with their journey much earlier. Moving to the campaign itself, we advertised during the summer and then began our very competitive process in the September. The workforce diversity was an important part of the inspection regime, but also our public sector equality duty. So at 2.10, we've talked about the number of applicants, how many were successful. We've also described that 7 are currently on-call firefighters, so those are people who've gone through our migration process and will be joining us as whole-time. Of the total that we recruited through the process and migration, 27 are male, 5 are female. We had 27 who were white British or white other backgrounds and 5 from ethnic minority groups. We expect 24, in fact we've already had 12 and we'll have another 12 in January, join our apprenticeship scheme, and I really welcome you to come along, members, if you want to see any pass-out parades. It's really quite a special event. The workforce plan has been, moving on, the progression process. We've amended the workforce plan timetable slightly. We will be doing them in reverse order. So we're doing station managers, watch managers, crew managers, rather than the other way round. That's purely because at the moment that's where our vacancies are. So it makes sense for us to try to reduce the overall number of temporaries by reversing the programme. Over at 2.12, we've talked about how we're doing against those diversity aspirations that we published. I'll just give you a minute to kind of look at those. We are working towards them. We're not achieving all of them. In terms of the recruitment process, we did not hit as many city residents as we had aspired to, which is disappointing given the level of positive action and support work we put into that. We also didn't quite get to the level we would expect for women, but bear in mind that 16%, we're talking very low numbers, essentially taking 24 new people in, 1 or 2 women makes a very large difference there. On ethnic background, we're much closer to where we wanted to be, and the same for our internal workforce. We're doing quite well in terms of supporting people there. Our support staff is close to where we would expect to be at this point for ethnic background and disability. And on sexual orientation, we are actually hitting where we would want to be in terms of ambition. So that's the declared workforce with that particular protected characteristic. Shall I pause there? I've gone through quite a bit already.
You can do, obviously. I mean, would you like to talk about the under-recruitment of people in the city? Is there an issue we've identified? Or?
It's very hard to understand why people in the city are not applying. If we looked in detail in the Into People report a couple of years ago at what those barriers were, it may be that we are less visible. We know we have a lot of the best advocates for working for us are actually the people who already work for us. So if you live in a rural area and you've got on-call firefighters in your community, they're actually quite likely to know somebody that works for us. In the city that is less true because people work whole time in the city. and they're very busy stations that are out at fires and incidents a lot of the time. That's why we've done that additional work within the city. We are at events, we are talking in schools and things like that, but it is a difficult target for us to budge, really. That's why, it's part of why our cadet programme is based in the city, so that will be, it will be based out of Stockhill eventually. It's currently at Carlton. Building work.
Thank you. Any other questions, comments?
Not from me.
No? Okay.
Okay. In terms of the other workforce plan priorities, attracting diverse talent and all talent remains a key priority for us. We're looking at leadership development for middle managers and focusing on equipping them with the right skills early to make sure they can deliver effectively. We have a number of leadership programmes at each level in place that we are supporting people through. As previously described, our health and wellbeing remains a key focus, and we are supporting changes to upgrade our welfare support, particularly mental health and wellbeing. And the workforce plan continues to receive considerable attention. We have quarterly workforce planning meetings in place now to make sure that we're assessing where gaps are coming, and we're doing that planning forwards. The only other thing within the report that I would want to bring attention to is the fact that the workforce continues to be 79% of our budget, so maintaining and managing supporting staff is such a big priority for us because it's a big cost and it's a big part of what we do. Thank you.
Thank you, Amy. Any questions on that part? No. Recommendations? Fortunately smaller. Members should note the progress made against the workforce plan, including areas where further action is required. Are we all right with that?
Yep.
Good, thank you very much. Move us on to the last agenda item, future meetings. Just for members to note, 6th of November, 22nd of January and the 23rd of April, which is St George's Day, I believe, isn't it?
It is my daughter's birthday.
Indeed. We okay with that, folks?
Yep.
Okay. Thank you very much for your attendance. I'll close the meeting.